that mean? Thought maybe we're talking about a state. How can we have Medicare in the state? Why do you think we're calling this Medicare for All? Anybody?
So people understand, they don't always know what's single payer.
If you go out and ask the average person what's a single payer, what percentage of people know what you're talking about? Who said none? Maybe 5%, 10%, whatever. How many people know what Medicare is in this country?
Everybody.
Right? My 10-year-old daughter knows what Medicare is. What we're talking about is a program similar to Medicare that can cover you, make sure it's the highest quality care for everyone, right? So with all that, I want to make sure you sign this petition. My name is Bill Gallagher. I'm riding the bus throughout the state along with Donna Smith back there. Donna, say hi. Where's Cindy Young? And she's back there, and Joe Rubin and other folks. And now to officially welcome you to this town hall meeting on Medicare for All, I wanted to introduce some local leaders here who did a fantastic job letting people know about the screening and this meeting. Great.
Thank you. I want to thank you all for being here. Welcome. And I'm a retired nurse myself. I worked 27 years as an RN and 35 years in the field. I wanted to, first of all, just make a mention that we're in a historic neighborhood here. Just about 4 or 5 blocks from here is where Cesar Chavez, as a young man, decided after experiencing discrimination and seeing it happen all around him for his life, for most of his life, he decided he wanted to do something about it and became an organizer for social justice. And so we're here to also organize for social justice, healthcare justice. You know, we want everybody needs healthcare sometime in their life. And there's no excuse in a country so wealthy that we can't have healthcare for all. So I wanted to recognize the folks that helped organize this event. So I'm the regional coordinator for the Campaign for Healthy California. And our local regional member coalition is called the Santa Clara County Single Payer Healthcare Coalition. There are so many organizations that are part of the Campaign for Healthy California to coordinate the campaign for single payer Medicare for all. California Nurses Association. Are there any of California Nurses Association here? Healthcare for All California. Raise your hand. The Low Income Self Help Center. The Community Homeless Alliance Ministry. The Physicians for a National Health Program. Do we have any members of PNHP here tonight? Maybe not. Okay. They were here earlier. Single Payer Now. Are they still here?
Yeah.
Yes. All right.
He's still here.
Green Party. All right. And League of Women Voters. Okay. So I wanted to also thank our co-sponsors, and particularly Milton Cadena and Mary Lou Christina, who are with Catholic Charities and helped and offered this venue for what we're doing today. So I want to give thanks to Catholic Charities. Also, the Services, Immigrant Rights, and Education Network, also known as SIREN.
You want a copy
The
of the event
Voluntarios
too?
de la Comunidad.
You want a copy of the event? You
They're
do.
here, yes, okay.
That's all right.
Don't worry. Appreciate it. Right. And we also, there are some elected officials that agreed to co-sponsor this event. Assembly Member Nora Campos, Supervisor George Shirakawa,
She's sitting. You
and
got the names.
San Jose City Council member Javier Campos. And also I want to thank the organizations that helped do the screenings today. We had the Foothill Community Health Center, the Pacific Free Clinic,
I'm Chinese, I cannot
and
speak
Dr. Liu from the Gardner Family Clinic. She was doing dental screenings. And also, yes, I want to definitely thank Loaves and Fishes who helped with donating some food and publicizing the event. So I'd like to introduce Catherine Bach from the Low Income Self-Help Center first. Has a few words for us.
Hi, Catherine.
Hello, everybody. Thank you so much for coming. This has really been exciting. The reason that we at the Low Income Self-Help Center are fighting for healthcare for all and have been for years is that the bill that just got passed and all of the federal bills and every program that we have so far really doesn't stretch far enough to cover a lot of low-income people, certainly not to cover us comprehensively. Almost everybody that comes to our center, even if they have the new Valley Care program, which is the low-income health program through the Affordable Care Act, which has a pilot program here, or if they have the Medi-Cal, they're trying to get the Medi-Cal expansion, or if they have Medi-Cal, most everybody has, nobody has dental care, for instance. So people come to us, and they're trying to apply for a job, we're trying to help with resumes, and they aren't in good health, and they may not have teeth in the front of their head, on their mouths, which is going to make it, I mean, it sounds funny, it's not funny when you're trying to find a job. I don't want to make you feel bad. But, and to say nothing of the really bad health risk that poor dental care gives us. I myself am low income, and I've been lucky enough to get on the Valley plan, the Valley Care Health Plan, which is the new LIP program they're talking about through the Affordable Care Act. I live in Santa Clara County, so I'm really, really lucky, because if I were going to land anywhere with no health care, this is the county for it, because there is some help here. And I have had, I have a primary care doctor when I needed it. I was able to make sure that I didn't have breast cancer. And very soon, within the next couple of months, I'm going to be having an acoustic neuroma surgery or that other thing, which I'm not looking forward to, the radiation. But it's there for me. And it was caught in time, and I'm getting the help that I need. But I'm Caucasian, I'm not an immigrant, and that's why the Valley Care program is open to me. If I were an immigrant, if I made just a little bit more money, that opportunity wouldn't be available to me. And so, from my own standpoint and from all of the people who we work with at the Low Income Self-Help Center, we want Medicare for all. Medicare for all. Comprehensive, universal, nobody left out, everybody in, for immigrants, for poor people, all people and young, everybody.
Now I want to introduce Lucila Ortiz from Siren. She wants to say a few words.
Good evening, everyone. How are you all doing?
Great.
All right.
Everyone had their dinner already? Healthy dinner. Well, my name is Lucila Ortiz, and I'm here with Siren, Services, Immigrant Rights, and Education Network. The work that we do is we advocate for the rights of immigrants, all immigrants. And I'm here to talk to you a little bit about what Catherine was just talking about why we need single-payer health system. As you know, the Healthcare Reform Act was passed in 2010, and it was just upheld by the Supreme Court last year. And so that provides a lot of help. There's 32 million people who would be uninsured if this bill wouldn't have happened. And so that was a great victory that happened last week. However, immigrants, as you know, have been excluded from the Healthcare Reform Act. So there's a 5-year limit, so even legal immigrants who are here and they still don't have 5 years in the United States. They're completely excluded, and of course undocumented immigrants, more than 11 million people in the United States have been completely left out. They don't even have the opportunity to buy health insurance. And so that's a big problem, and it's really unfair that we're leaving a part of our community out of health insurance. Fortunately, we do live in California, and California has stepped up to the plate to provide that health insurance for those immigrants who have been here for less than 5 years. But even that is at risk right now because of the budget that has been happening. As you know, there has been a great deep cuts in the budget for health and social services. So for example, to the CalWORKs program, there has been more than $3.3 billion of cuts to the CalWORKs program. And that has resulted in $3,000 less per children who are in the program. For the medical program, there has been $2.4 billion in cuts since 2008. That has impacted 7.7 million people. And finally, as you know, the budget that was passed, also just a couple of days ago, they eliminated healthy families. And so that means that more than 35,000 children who are enrolled in that program will also be impacted. And so that's why we need the single-payer health system. Everybody in our community is a human being, and that's the dignity that everybody deserves. It's not fair that any one person is left out of their own health. Everybody should have access to taking care of themselves. They should have access to living well. And if we provide health insurance for everybody, the community does well in the long term. So just to do the fair thing and the human thing, we need to pass single-payer health.
Okay, thank you so much for that welcome. What I'm struck by here is I hear Catherine, lucky to be in Santa Clara County, right? Lucky maybe to be in California if you're an immigrant. But then they take this thing away from us over here, healthy families, right? Do you ever feel like you're chasing mice around on the floor or something and you're a cat who can't catch them all? What a terrible analogy I just gave, by the way. But the point is we're playing patchwork games with our health care. Single payer takes all of that out of the equation and says we have one system that will take care of you and you and you, whether you live in Hawaii, California, immigrant, not, Santa Clara County. Are you with me, folks? We got to stop these patchwork games. So with that to be said, we got a video here that I hope you'll enjoy, and I'm going to shut up and hopefully somebody in the back, you can hit the lights.